My name is Daniel Goldbloom. I'm an orthopaedic surgeon with a subspecialty interest in surgical conditions of the foot and ankle. We're here in the studios of the Australian Ballet to demonstrate some of the exercises that will help you obtain a best possible outcome after your surgery of the forefoot. Their exercise program has been extremely successful in improving rates of injury amongst their dancers, and I believe it has equal relevance in the rehabilitation of cases involving surgery on your forefoot.
Hi, I'm Sue Mayes from the Australian Ballet. Foot intrinsic muscles are really important for ballet dancers, and we teach them these exercises that we'll show you today, not only to prevent injury but to manage injury. So this exercise is to strengthen toe flexion, and we start the ankle underneath the knee in a neutral position. The foot's flat on the ground and they've got equal weight bearing between the joint of the big toe and the joint of the fifth toe. Then we put the TheraBand, and this can be different colours, so we might use a light red band. In this situation we've got a green band which is slightly thicker, and then we could progress to a blue band. So then we link the TheraBand underneath the toe like a sling, and the idea of this is to keep the joint in the middle of the toe straight while we're doing the exercise. And then Susie can hold on to the TheraBand from that point. She starts with the toe slightly lifted off the ground and then slowly pulls her toe down to the ground and then presses that toe strongly into the ground and holds it for 2 seconds. And then slowly releases the toe. Whilst she's doing this exercise, she could try to keep that toe in a straight line and not let it deviate to the outside of the foot. And we'll do this at least 5 times, but aiming for 10 times. So she releases the toe, then she pulls it down, pushes into the ground for 2 seconds, and releases it for a second. So overall there's about 5 seconds of activity. So she pulls it down for 2, holds it for 2, and then releases it. As you go, you should start to feel some contraction of the muscle on the inside of the foot where sarcus is pointing. So down near the navicular, the muscle is contracting and you should feel that muscle tightening, and relax. And then we keep going until it starts to fatigue. And generally the very first time, someone might only be able to do 5, but we aim for 10 repetitions, and then they rest, and then they could do another 10. If they're struggling to keep that alignment, we can add a little foam pad to direct the position. It's important to keep the TheraBand directly above the toe, and you can even rest your forearms on your legs for a bit of support. And then the toe doesn't need to come up too far off the ground, and it's important that the other toes stay connected to the ground as the big toe is raising and lowering. So here we have Karina Aramura, and she's a classical ballet dancer with the Australian Ballet, and she is quite an expert of doing this exercise. She's in fact rehabilitating an injury at the moment. So Karina is going to get in the same position, but this time she's using a blue TheraBand, which is thicker and harder to move, so she's quite a bit stronger and she's got the technique very well. So again, same setup with the ankle underneath the knee. The foot is flat on the ground with equal weight bearing between the first and the fifth metatarsal heads, and the band is directly over her big toe. So she will relax the toe and let it come up into a little bit of extension. She's using the TheraBand to work as a sling, and she's keeping that joint in the big toe, in the middle of the big toe, straight. And then she pulls it directly down, holds it for 2 or 3 seconds, and then releases it. All the time she's keeping the second to fifth toes flat on the ground. You can even in this situation see Karina's abductor hallucis contracting as it works hard to flex that toe down. The abductor hallucis muscle is really important because it gives support to the inside of the foot, but it's also the main flexor of the big toe, which is really important when walking to propel the body forward. And as you can see, it's a nice, slow contraction, and she's doing at least 10 repetitions. She's keeping that toe aligned so it's not deviating off to the outside of the foot, and her other toes are keeping contact with the ground. So once they've got the technique of doing the first toe, then we go to the fifth toe. And the fifth toe, though it is a small toe, is actually got quite a decent sized muscle, the abductor digiti minimi. And it flexes that little toe down to the ground and keeps contact with the ground so that the foot can weight bear not only through the inside of the foot, but also get good strength through the outside of the foot. It's a little bit challenging to try this with a TheraBand. So we usually begin with just extending the toe up with the finger, as Sarkis is doing, but Susie could try this with her finger as well. By keeping all the first to fourth toes on the ground, she's just lifting up the little toe slightly and pressing into her finger and getting a good contraction through that abductor digiti minimi, the muscle underneath the outside of the foot. While she's doing this, she should keep the big toe, the second, third and fourth toes connected to the ground. And again, she could do a 5-second active contraction. So she pushes down for 2 to 3 seconds and then releases. And she could do that up to 10 times. She could then repeat that for another 10. So once they've got the strength just using the finger, you can place the TheraBand underneath that fifth toe. On occasions, if this is too difficult, you might need to use a red band. But if they've got the strength, the green band is held directly above the toe. And just as they did with the first toe, they pull down for 2 to 3 seconds, hold it there, and then release. Again, the big toe, second, third and fourth all stay connected to the ground throughout. They could do up to 10 repetitions, and then they could repeat this. Karina's now demonstrating strengthening up the intrinsic muscles that attach to the second toe. Before they develop strength to go to a TheraBand, we might actually use the fingers to keep that little joint of the toe nice and straight. So she's just extending the toe up, she's using her thumb to keep that joint straight, and then she'll pull the toe down to the ground. She'll hold it there for 2 to 3 seconds, pushing into the ground, and then she releases it slightly. She shouldn't lift the big toe or the other toes while she's doing this exercise, and in fact they should press gently into the ground at the same time, so we're getting strengthening of all the intrinsics of the foot. Strengthening up these middle toes are quite challenging, and so you might start with a red, progress to a green, and then finally progress to a blue TheraBand. But Karina's been doing this for a long time, so she's nice and strong, and she can keep that second toe quite straight as she's pushing it down into the ground and then releasing it. This is an exercise that you could do every day. In fact, some people even do it twice a day. We do up to 10 repetitions on each toe, then you could repeat that, so it's 20 on each toe altogether. And that's a lot of repetitions if you're contracting all those intrinsic muscles all at once. So at least once a day is ideal for this exercise. If you're doing this exercise correctly, there shouldn't be any pain in the foot or the toes. The toes should move in a comfortable range of movement. And if there is a bit of stiffness or very low-grade symptom, it should get better and certainly not get worse as you continue the exercise. The muscles in the feet should contract, and it should be quite a comfortable feeling through the foot. There shouldn't be any tension through the tendons around the ankle, and you shouldn't be feeling the calf contracting.
This program can be followed exactly as demonstrated or it can be tailored to suit the specific surgery that you had. Please remember to call the office if you have any questions as you go through the program.